And why is there such a lack of study in these fields in pertaining to like women's vaginal health and like menopause and all that stuff? Like,
because, it doesn't revolve around men.
Get on in.
Oh no!
I know.
OBGYN has to get in.
I know. I feel like this is like Black Mirror episode for you.
Like this is like karma. Scoot down.
I know. Scoot down. That's what they always say. Scoot down. I'm gonna go full on.
If I could have a button just to scoot people's butts,
you got to get your butt up.
Oh my God! Can I even?
Do we need to prop you up?
Do I need to? Okay.
No. Get yourself like this. Like you don't have to put your legs up. Oh, it's a mess. Oh my God, where you?
That's our.
All right, we're getting straight into it.
Stirring things
I love
up.
that you're going full out. I mean, you don't even need to.
I want to show my patients. I want to show women that I'm just not sitting here telling you guys to open wide. I'm actually doing it myself.
Good.
So that's the one thing that I know, like women are like, hey, Dr. Stigger, like, is this enough? No, I need you like this, or I need your bottom to be hanging off the bed. And there's a reason for that.
Tell us.
The reason is because your perineal muscles, the muscles that we use for our Kegels, the muscles we use during sex, the muscles that we use when you're urinating and then when you stop your urine. So if you have strong muscles and you're not hanging off the edge of the table, actually it just makes it harder to put in the
closed in. Yeah, it's more closed because the muscles are tight.
It's very tight. And so when you are hanging off, you naturally relax down there.
Oh, I love that.
You
open up.
I mean, it's so like people are like, I hate going to get a pelvic exam or a speculum exam because the speculum hurts me. That only hurts if you don't open up.
Because you're going like this.
Because it's grabbing, the speculum is grabbing the side of your vagina. Ouch.
Yeah. Why do you think that women are so uncomfortable? I mean, besides the fact that it's like we put so much shame around our vaginas and that's a whole episode, but like, why do you think women are so like nervous at the doctors? Like, what is it about going to the OBGYN that makes them so stressed out?
Well, I think that it's such an intimate thing. And, truth be told, quiet as kept, I hate going to the doctor, period. My doctor retired. He was a male gynecologist. I had him since age 19, the best.
I love going. Like I was just talking about this.
Okay.
I like learning about it. Like I told our last guest, like my doctor one time was like, look at your discharge. And she like went like this. She's like, it should be more sticky. It should be more clear. It should be more that. Because I think a lot of the information we get is like, rather like it's TikTok now, really. All the information we get.
I can't let you go on. I need to stop you. Let's roll it back.
So she goes she took a little bit of my discharge.
That's what I'm talking about.
She was like, this is the texture. Do you see these little pieces that should be more smoothed out? Like if you, with the probiotics and like your levels and stuff like that. I don't think we know. Like women know, we know all the tricky things. Obviously, I saw some interviews you did with like, if you drink pineapple, your vagina tastes better. But it's like, you know what I mean? There's so much beyond that we don't know. But let me stop you real quick and let's say welcome. To the Stir-Up.
This is how I like to start.
Me too, just right into it.
Okay, let's do that.
Yes, welcome to the Stir-Up, a podcast brought to you by O Positiv. We are going to stir up all that has to do with women's health. I'm here with board certified OBGYN Dr. Kendra, overall kick-ass woman, has her own business. And I'm just so excited to get down and gritty. My little storyline right now is I'm going into early perimenopause and I started hormone therapy. And I have a million questions, but like taking it all the way back to what got you into gynecology?
I never wanted to look in people's vaginas or have anything
that wasn't a thing?
Down there. So this was unexpected. And people who know me are shocked, just as shocked.
Really?
Yeah, because I never wanted to have anything to do with women, basically. I was a tomboy growing up. I was a tennis player, a competitive tennis player, so I had a lot of male friends, and I just wasn't into it. But I caught my first baby as a medical student, 10-pound chunk of a hunk. Okay.
Wow.
And I got the bug, and I said, you know what? I don't like sick people. I don't.
That's what our other gynecologist
like, you're so
said.
Stupid. Like, why'd you go to medical school? Like, you're in a hospital. And I'm like, oh my God, you're right. But it's too late now. What do I do? And being at a birthday party, being like the hero that caught that baby, not dropping the baby.
Yeah.
And to really be a part of a moment in people's lives that they'll never forget. Right? Like this is like the first birthday party that I get to be a part of, and that family is going to remember me. That mother is going to remember her whole prenatal experience, and you got to be healthy to have sex. So I like healthy people. I like issues that I can fix. So I just don't like chronic
problem
disease.
Solving.
Yeah, I just like, hey, you're bleeding out. You already have 10 kids. You don't need your uterus. She's rebelling against you.
Yeah.
Let's take her out.
Wow.
You know what I mean?
Yeah.
I like to fix it, and be done with it. And the good news is no one stays pregnant forever. So, we all have our favorite patients. And with the same breath, I would be lying if there were some patients that I could, do without. And so the good news is no one stays pregnant forever. So even if I'm dealing with a patient who's a little difficult, due to maybe certain social circumstances or just because she's having a day, no one stays pregnant forever.
Right.
Thank God.
But I feel like there's so much like information and help towards women with like fertility, getting pregnant, all that stuff. But what about the girls out there who are just like vaginal health, overall vaginal health? Like, what do you recommend for women like are scared to go to the doctor, or like what are some resources for women who like want to get a little more educated, but like they're maybe nervous to ask their doctor in the room?
Well, first of all, a podcast like this.
Oh, there you go.
Like you have to understand like what's happening here. We're talking about the vagina. We're talking about sex. We're talking about, GYN problems. And I know that it's 2024, but it's still a touchy subject. It's an intimate topic.
Wow.
So platforms like these, I love coming on because people who avoid the doctor, they'll listen to a podcast. They'll listen to this.
Right.
Versus actually going to the doctor and getting that information. They rather sit in their car, drive home, listen to a podcast like that they can relate to. And maybe one woman would go get her one-woman exam.
Right.
It's just anxiety provoking, especially the pandemic. A lot of women miss their mammograms, miss their cervical cancer screening. And if you kind of don't like going to the doctor, like I hate going to the doctor myself, it's just easy to put things off. And women, we take care of ourselves last, right? We do everything for everybody else. And then 3 years goes by and you haven't went to see your gynecologist.
Yeah. Well, what are some things everyday things that we can do to like promote vaginal health?
I think just talking about it, and that's what got me on like these platforms of Instagram, TikTok, is because I just wanted to reach more people. So just being more comfortable talking about it, finding a physician or a healthcare practitioner that you relate to.
Right, that you like.
Yeah, shopping, not giving up, like not just settling for an uncomfortable experience and not changing your provider. So that is the biggest thing that I can tell people. I tell my patients all the time, there is a doctor for every patient, and there are patients to every doctor. Not every, you won't believe this, but not every patient likes me. And my husband may believe it, but I don't.
Yeah. That's how I feel about audience members. I'm like these vagina jokes aren't for you.
I'm like, I am super nice. Are you kidding me? Got to be. So, believe it or not, Jade, not all my patients like me.
Oh my God, scandaloso.
And so I tell patients, it's just like dating. You keep shopping until you find someone you're comfortable with. And to help get rid of, you asked me earlier, like, how do we make it easier? How do we talk about these topics that are so important for us? How do we get more education? The more comfortable you are with your physician, the easier visits get.
Well, I feel like women don't even look at their own vaginas. Don't you recommend, go in the mirror, look at your vagina, know it in and out, which is so wild to me. I think that there's been so much built up shame, just even in the physicality of the part, that we just don't give it any love, you know?
Right.
And then we were talking about this STDs, like people are so scared they're so scared to have one. There's so much stigma around it, but like, talk a little bit about like HPV. Everybody's had it, right? At this point, like I got it when I was like 16.
Right.
It's vintage at this point.
Right.
I had it so long ago that they didn't even know you could get rid of it. Like that's how long ago I had it. I was like, I have this for life.
Right.
But now there's like all these multiple strains of it. Can you talk a little bit about HPV in particular?
Okay, so the human papillomavirus, and just a no disclaimer, like even though HPV, they have commercials, you know, we have a vaccine to help decrease your risk of actually getting it and decrease the risk of it going from high risk HPV to cervical cancer.
Right.
But a lot of women still don't know it's an STD infection.
Wow.
STI. We call it a sexually transmitted infections, but for some reason, a lot of us just want to say, you know, disease, because, you know, it just, you know what I mean?
So it's not a D, it's an I.
Yeah.
Okay.
So the disease, it just, you know, for me, I think as a patient, if God forbid, you know, God help my husband, if I ever got something, for me, that would be disease. You know what I'm saying? You messed with my V, it's a disease, and watch out. But just to answer your question, the human papillomavirus, I need everyone to know that it is transmitted sexually. There's strains that actually cause warts, and then there's the high-risk strains that put you at risk for cervical cancer.
Scary.
But everybody needs to know that just because you have HPV, that does not equal to cancer. So when people hear the word cancer, they're thinking that this test is going to say if I have cancer or not. So if you do have an abnormal pap smear, a lot of women get high anxiety when I tell them that, hey, you have some abnormal cells on your cervix. So the whole point is we're doing the screening to prevent you from getting cancer. Right. So that's important for women
like there
to
wasn't
know.
even a shot around when, you know, you date one guy that works at Gadzooks and then it's over. But I feel like now there's so much education and girls are having it so much earlier, which is interesting because like I feel like these generations are not as sexual as we used to be. And why is there such a lack of study in these fields in pertaining to like women's vaginal health and like menopause and all that stuff? Like
because you know, it doesn't revolve around men, to be quite honest.
Really? That's
you know, and everything that we hate as men oppose. Okay.
Can we get that again?
You know, I mean, it's like men oppose, like literally peri, men oppose. I mean, you know, it's just, it goes on. And I think that because women, we don't really complain. We don't talk about it. So things aren't being studied and there's not a lot of, you know, push to just get information out there. But I think within the last probably 5-6 years, I've been very impressed because there's more podcasts like this that's promoting this. So hopefully we get to just continue on this wave of, you know, fighting for, you know, reproductive justice, fighting for education, fighting for what I really want to fight for is to have menstrual days.
I agree.
Okay, period days. Like, you know, why should a woman have to use her sick time for her
something
periods?
That you're given? Yeah.
You know,
free
and,
tampons,
you know, like,
the whole, like why are we not coddled? I was just talking about this, like these commercials that promote, like you get to be active swimming with a tampon in. And it's like, you should really promote women like resting on those days and taking care of themselves. And I think like as a younger hetero woman at the time, I was like, I don't want to be one of those girls.
Right.
You know what I mean? We have this like societal, like, you can't be complaining. You can't, but like,
that's what it
let's
is.
complain. Like, let's complain out loud. Like emotionally, physically, we're in pain once a month, if not more, you know?
Right.
I noticed I was going through perimenopause because 2 weeks before my period, I would just like lose my mind. Like my PMS was just like, I almost thought I was like, am I bipolar?
See, that's not, I mean, perimenopause starts at age 40.
Yeah.
But what you're, and I'm not your doctor.
No, please,
like,
the more information,
But what you're really experiencing as we get older, you know, our PMS gets worse.
Oh, beautiful.
Yeah, you know.
What do we look forward to?
And so that's a difference there. So I think that, you know, if we manage you as to control your PMS symptoms, that's going to change your life. So
what are some things that you recommend with that?
To get the right diagnosis. So there's actually medication you can take that we actually give for anxiety and depression, because one thing about, couple of things about PMS, that as you get older, the agitation increases, the mood swings increases, you know, the fatigue.
The fatigue is real. It felt like someone was literally throwing me down, like physically.
The fatigue as you get older gets really bad. And so, just getting the right diagnosis to begin with. And again, I don't know. I'm not in your medical record, so I don't know what the other provider
would you like to get into
my
medical records?
You know what I mean? But I think that if we can control that, you know?
So are you talking about SSRIs, or is there a different?
Okay, girl, you already
Okay, yeah. I've just never taken SSRIs. I'm scared to, obviously, because again, the whole like, oh, you're on antidepressants, you're on this, and then getting off of them. But
I tell people, like, it's not forever. You can do something temporary, and no one needs to know the truth.
True.
But your lawyer, your attorney, and your doctor. You can lie to your family members, lie to your husband, but never lie to your doctor. I can't stress that enough.
No, I never lie to my doctor. When people are like, I don't tell them I smoke weed, I'm like, why? That's such a thing that could help you in the future. So SSRIs is something that women can investigate as far as like really painful PMS or... do you think that as far as like hormone therapy, I know this is not like your specific field that you specialize in, but are you finding that there's more information now on hormone therapy and the benefits?
Well, believe it or not, Jay, that's still under my jurisdiction.
Okay, good. Well, I don't know. Some people get like, that's not my thing.
No, yeah. So there was a study that was done way back in the day. So a lot of like older doctors are afraid to treat give women hormones, so we're suffering. And I'm 45, so I'm definitely feeling mood swings, hot flashes all of a sudden. Low tolerance for
bullshit.
I mean, I was just gonna say
I'm honking. Didn't even know I had one of those until like a month ago.
And so just for funsies, so I actually have lab work to do to see where I'm at, but I haven't got it done yet. Again, it's like a mental block for me right now, but I'm trying to pump myself up.
That's so interesting to hear doctors say that.
I told all my friends, I said, you know what? I'm not going to be friends with anybody that's menstruating, bitch. I'm looking for women who are on, their way out. For their reproductive career.
Yeah. And there's a sadness to me. Like I remember, so I started taking progesterone and it really helped with my mood and my energy.
Did. Okay.
But not synthetic, the pills.
Okay. So that's like birth control. Yeah, so that's appropriate. So the first thing is birth control pills. That's the first line treatment for anyone experiencing, I don't lump, perimenopause. You just turned 40. I mean, not saying that you don't have any vasomotor symptoms. You know what I mean? I think we all know, like end of 30s, you can start feeling it. It's just the science is just behind what women already know.
What are some things that you don't like recommend about progesterone? Just talking a little bit about that.
I don't recommend. It's really the estrogen.
I just started the estrogen 2 weeks ago.
But you have to be healthy.
But my eyes are so dry.
But the looks of you, I'm thinking that you're okay with it. But so it depends on your risk factors, obesity, smoking cigarettes, if you have hypertension, diabetes. So we want to
What's hypertension?
High blood pressure.
Okay.
See, do you see how you just stopped me? You just said, what's hypertension?
Yeah.
A lot of people don't feel comfortable asking, like, what is something? I do this every day. So hypertension, that's like layman's terms for me because it's in my world. But I forget sometimes. It's not regular terminology. Who would know what that is?
Right. And we don't know anything. Like even with HPV, like I remember when my doctor's like, you can get the shot now so you don't get the other strains. I'm like, there's multiple strains. Like, so like, besides the resources of like podcasts and stuff like that, like, are there things in your health that you can tell at home? Like, hey, maybe something's off. Like,
trust yourself. Mm-hmm. Women, we're just amazing. We know that there's a change in our body. And if there's a change that you're not feeling your best, listen to that voice and go to the doctor. And now there's telemedicine. Okay.
Right.
That's like life-changing. I do a lot of televisits, as a patient. I'm like, can I just have the doctor call me?
Yeah.
So I think that slowly the barriers are getting, less because now you can have a phone call, you can have a video visit because a lot of us don't go because we're super busy and we have to drive over there, have childcare, which I didn't have today.
Yeah.
And so, I think that really helps in the overall, getting to the doctor and trust yourself. A lot of women, they come to me and it's like they're bleeding to death and people are telling them that it's not normal. Even I experienced that. I have fibroids. And so just the denial is so strong in us.
Can you talk a little bit about fibroids actually? Because I feel like a lot of more women are getting fibroids more than ever now.
Yeah.
And I don't know if that has to do with like our endocrine system being attacked by all the stuff in the food and the plastic.
Yes.
So talk a little bit about fibroids and like what to look for.
So fibroids are benign, smooth muscle tumors of the muscle of the uterus.
Okay.
So it's not cancer, and it's most common in the 3rd, 4th, 5th decade of life. And so, and in Black women, we get it earlier, 10 years earlier than all the other women.
It's a whole other podcast too.
It's just, and so so that's the first thing. And it could be anywhere on the uterus. So that means it could be inside the uterus.
Could you actually feel it? Like if you put your finger inside, could you feel it or no?
Because it will be in the uterus.
In the uterus, so you'd have to like really go.
Yeah.
Okay, yeah.
And so you might experience bloating. You may get full, faster sex may be uncomfortable. Bowel movements may be uncomfortable.
Wow.
Those are called bulk symptoms. And then the other side of it is the bleeding. So you don't really have to do anything unless you experience that pressure symptoms or heavy bleeding.
Like super heavy.
Right.
Like it's very noticeable amount. My friend was like, it looked like murder scenes. I'm like, oh my God.
Or like,
you got to sell the mattress
clots.
now. Yeah.
Just trailing off,
Yeah. And what's the difference between a fibroid and a polyp?
That's a great question.
Thank you.
So a polyp is actually an endometrial cell. So in your uterus, we have tissue called endometrium.
Okay.
And sometimes you can have a cell like do an outpouching. So just get a little bigger, the endometrial cells, and it causes bleeding in between your periods. If you're if you're still getting periods. And for women who are older, for postmenopausal women who don't get their periods anymore, it can also, cause bleeding. And that's a source that I'm thinking about. Like, we always think cancer. All the doctors in any specialty, cancer. That's like the worst.
Yeah.
But that's one of the etiologies, one of endometrial polyps are one of the etiologies for postmenopausal bleeding. So you need a biopsy if you are postmenopausal.
Okay.
But for a woman who's still having her period, you could have signs of a polyp that you may have to go to the doctor, is that you're bleeding every time after sex. Because once that penis is hitting the cervix, it can make polyps bleed. Or if you're bleeding in between your periods, those are the two most common signs of an endometrial polyp or a cervical polyp.
Okay, cool. And then what about a cyst?
So a cyst is usually people get cyst in their ovaries.
Right.
So a cyst can be filled with different stuff, like most commonly blood.
Wow, fun.
Okay, or we call it physiological fluid, which is just normal.
Oh, it's not
like
dirty
just
to me.
normal, cystic fluid.
Yeah.
Or this weird one. It could be filled with bone, hair.
I've seen this, Dr. Bimble Popper.
Yeah, dermoids.
Yeah,
dermoids.
And inside.
Yeah, like when you get it and you open it up. I mean, you're pulling out hair. It's just like Crisco grease everywhere.
And how can you tell that you have a cyst?
So those symptoms, you may experience pain.
Yeah.
Okay. Related to your period. If they're really big, it could be when you're off your period, after you eat, you just feel a heaviness, you get bloated more.
That's something you could physically feel.
You can't, because the ovaries are, it's depending.
Still deep inside,
It's like there's, I have some patients who are like super skinny and then you can feel it on the exam because it's that big.
And then just to go back a little bit, because I think something that women are figuring out they have more is endometriosis. Am I saying it correctly?
Endometriosis. Yes.
So tell us a little bit about that.
So endometriosis is when you have going back to the endometrial tissue, so the tissue that makes the menses, is when it is not in the uterus. So that means
when it's outside of the uterus.
So when it's on your bowel, when it's on your ovary, it can be on your bladder. It could be what we call in your posterior cul-de-sac, so behind the uterus, or on your ovaries. So endometrial tissue that is just outside the uterus. And so that can cause pain because every month when you get your period,
intense pain.
If it's on your bladder or if it's in your GI tract, your colon, like you could have cramping.
So is it and it can be in a bunch of different places?
Yeah, I had a patient, oh my God bless her.
Yeah.
She got it in her lungs. So every month when she had her period, she would just have buildup of like fluid in her lungs from the irritation. So it can be anywhere, actually.
How lucky are we?
Like it's crazy. And the thing is, we still don't know why.
Okay, I was going to ask you that next.
Theories,
I'm like, why? Yeah.
Genetics, or it could be, so genetics in a standpoint, of, if your mother had it, you get it. Usually it's a skinny girl. If she's an athlete, and having heavy periods. And so we control it with birth control. Or it could just be the cells that, the endometrial cells are just there outside already in your bowels. Or the third one, which I kind of think I agree with more, it's retrograde menses. So meaning that instead of going out, it goes backwards. Yeah.
Wow. So what are some symptoms, like extreme pain during your menstrual cycle?
Yeah, like to the point where endometriosis can be very painful.
Yeah, I have friends who are just completely bedridden. I mean, heating pad, throwing up, stuck on the toilet. Yeah. I mean, like you can't leave the house style.
Yeah. So I would say, hey, make sure you don't have endometriosis. You could just have primary, what we call dysmenorrhea. Dysmenorrhea is a fancy term.
I've never heard that.
Painful periods.
Wow.
So it could be that, right?
And how do you test for that?
So it's a diagnosis of exclusion. Literally. So it's like so I would treat you like if I kind of figure, you're the right age, you're having, so going back to the symptoms of endometriosis, painful periods, pain during sex, pain during bowel movements. Those are like the most common things. And so remember, because I said that the endometrial tissue can be anywhere. So pain during sex because it's behind the uterus. There.
Oh my God.
Pain, you can have pain even like while, when you're eating.
Yeah.
I mean, it's just, and it will go with the menstrual cycle.
Yeah.
It will go with the menstrual cycle.
This is making me think about a lot of things. I want to break down like cramps during my period. Like I get a cramp. My sister gets this too, where it just feels like someone's poking me in my butthole. What is that?
That's just referred pain.
Okay.
Yeah. So like sometimes pain can be so intense.
Yeah.
It could be here, but you'll feel it here.
Yeah. It just feels like someone's going like literally like that, which I love usually regularly, but it doesn't feel good. And like my sister and I are like, why are the only ones, are we like genetically getting the same period pains? But more and more as I talk about it, more women do get like kind of a
sharp shooting. I mean, I had a patient who said that, every time she got her period, she had chest pain.
I get chest pain. I get like really bad heartburn.
Pain, you know what I mean? Like it's just like there's pains that you just can't explain sometimes. So I usually tell women, document it. Keep that menstrual diary, keep the pain diary, because the more you can tell your doctor, the more we could kind of get to the nuts and bolts of the right diagnosis. And there's a lot of us that get delayed diagnosis because we're not doing our homework. Patients think, hey, during sex, I have chest pain. What is it, Dr. Segura? And I'm like, what? I mean, you tell me.
Yeah. I'm like,
So
is it suppressed anger? Is it?
Yeah. So the more the more you can say, hey, I get it after I eat. Hey, I get it when I'm on my menstrual cycle. The more detective work you do, because it's actually especially with pain, it's actually both of us kind of putting on our detective hats,
putting it together,
and really taking the time to listen to your bodies and to kind of document. And then we come together and we discuss.
Yeah, it kind of pisses me off because a lot like mental health, there's not a lot of preventative medicine. It's all like after the math, after it happens, we can go, okay, this is how you make it a little bit better. But there's no like, hey, if you do this, this, and this, you won't get HPV. Or if you do this and this and this.
We don't talk about it.
We don't talk about it.
Having a good lifestyle just adds to better vagina health.
Yeah.
Better health overall, ovarian health. Yeah. And I think now people are looking for things other than medication to kind of prevent things. This generation, okay, one thing about like this generation, going back to how they don't even drink alcohol. Okay?
Right.
They're looking for things that are natural to deal with period pain, to deal with perimenopause. So, bravo, to deal with like vaginal discharge that may not be normal. They're tired of us gynecologists throwing medications because I throw hormones at everybody. I'm like Oprah.
Yeah.
Hey, you get one. But if I get to have more resources and just more natural things that can help patients prevent and kind of get that healthy lifestyle, because that just, healthy overall, and even like the uterus.
There's all these companies now that have gummies.
Yeah. Like I'm just like, I was like, hey.
No, I like it. I love talking about the subject matter because I get overwhelmed. Like I'm nervous that I started these hormones too early. And I'm like, have I done damage or taking them too early?
No,
Can I keep it up?
Birth control. So if that doesn't work, so birth control always be first.
Okay.
Which is, birth control is a misnomer, like it's hormones. People hear birth control. They're like, oh, Dr. Sugar, I got my tubes tied. You don't remember? Or
it's like, no.
Parents are like, when I get the teenagers, like, oh my God, she's not having sex. I'm like, understood.
Yeah.
But she's having pain. She's missing school or missing work. It's interfering with her life.
I initially started because of that. I would just couldn't stop throwing up when I got my periods really young.
Yeah.
And so I got on birth control. I was on it for like 15 years.
Good for you.
And then I'm gay now. So I was like, oh, do I need this anymore? And then when I got off of it, everything smelled weird to me. It really affected like the way I smelled things when I got off of the hormones. Then I was fine, got on hormones now. Okay. So the progesterone is a pill that I take. And then I just started the estrogen patch.
Oh, I was going to ask.
2 weeks ago.
How is it? Do you like it?
I feel really good. However, there's weird pains. Like in the middle of the night the other day, I woke up like in the middle of the night with my eye sockets and my eyes hurting so intensely. And then I read about how it affects your tear ducts and how you can get really dry eyes.
It can, but I tried the patch about 3 weeks ago.
And you didn't like it?
Again, no, I loved it.
I love it too.
I loved it.
Okay.
A lot of people don't know that one of the signs of decreasing estrogen is your skin can be very dry. So I kind of remember my denial game is strong. So I'm like, so I have alligator skin and I'm like, the regular lotion isn't working. I'm thinking, you know what? I need to up the game here. The Vaseline wasn't working. I'm like, I need like uracil. I need
the cocoa butter.
I need my husband to rub me down with olive oil. Yeah. Okay. And so, the little voice inside said, girl, you're in perimenopause. That's why your skin
how I've been
is dry.
feeling. And everyone's like, it's too early. But everything made so much sense setting up. I like broke out the first week, like a teenager. I hormone pimples. I was like, oh my God, I'm a kid again. More energy. But then I also have very intense chest and breast pain.
Really?
Yeah.
Okay.
And I had open heart surgery as a baby.
Wow.
So I get very nervous about heart disease, any kind of thing like that. But the more and more I read is like the lack of hormones kind of builds to that rather than the opposite thing. Like they say, if you don't have hormones, you're more likely to have osteoporosis.
Yes.
Heart disease. Dementia is the huge one. I listened to an audiobook. Women weren't supposed to live beyond having children much longer. So like we live longer now, but our bodies sort of haven't adapted and haven't, we haven't giraffed up to the top.
Women don't live longer after having babies?
They were like, when we were like cave women.
Oh,
you know what I mean?
Yeah.
Like we're cavemen where we live for a little bit. They're fine. They're hunting. We die.
Exactly. They're not. I would have died if I had heart during caveman times. I would have died. His head was like 99th percentile.
He does have a big head. He's very cute.
Like humongous, so he would have never came out of my vagina. So I would have been dead for real, like totally.
No, you would have been sitting up though, like squatting. It would have been a whole thing,
and it wouldn't have come out. You know what I mean? So, what were you saying, Jade? What are you talking about?
We veered.
Forgetfulness is one of the...
Brain fog was my number one. I'm a comic. I would just be on stage and go like, Gah. And then I read something that it was every 6 words you forget during perimenopause. What?
I mean, I used to have an okay memory.
Yeah.
Then after having heart, mom brain, I had pregnancy brain, then it went to postpartum brain, then it went to mom brain, and now it's like perimenopause brain.
We suffer nonstop. And there's nothing that helps us societally. It's wild to me. I just listened to these books and I'm like, I'm just pissed off because we're supposed to keep up, right? With the other, like with men, but we don't have any resources that are given to us. Like there's no help. Like we're just trying to work harder to keep up. So it's good that we're doing this and talking about this.
But even myself, I think that we're just all afraid to talk about it because we don't want to seem weak. Mm-hmm. We don't want to seem like, it's not good. Like, people don't talk about their kids. I noticed that, like, even sometimes, even I, like in the mornings, like you never want to, if you're late to work, you never want to say it's because, I had to drop my kid off at school. He just started kindergarten. I'm a new mom with the school stuff. And I'm like, now I'm thinking, oh my God, at kindergarten, it's actually, when they give homework, it just hit me, dude. I am going to be the one actually doing it. Yeah. Like, so it's like, now I have homework. Yeah. Okay, I'm going back to school. Okay, I have my own medical stuff.
And you have to look hot. And your vagina has to smell a certain way. You have to be skinny. You have to be smart. You have to make your own money. Like it's too much.
And I think that saying, if I sit here and I say, hey, I can't do all these things. I need help. And so being a mom has really kind of got on me about like asking for help. I never asked for help, but you know what? Medicine and motherhood will bring you to your knees. You know, yes, I need help. Yes, I'm reaching out. Yeah. And so going back to perimenopause, you know, I put myself on the patch. I had more energy. My vagina was so moist. It was. I
love that. I just want to be wet all the time.
Like wet. I was like, you know, I was thinking about sex constantly. You know, men think about sex like what, every couple of seconds, guys?
No. They're thinking about sex even as we're talking about cramps in the butt. Yeah.
And I was like, oh my God. So I was just thinking about sex constantly.
Yeah.
And so I think that it's undertreated. I know for a fact that it's undertreated. And my mission is to make sure that if you have any perimenopausal or postmenopausal symptoms, hey, there's non-hormonal options and hormonal. I think we're scared because we hear, you know, estrogen gets a bad rap.
All the studies that they did, how they were so skewed, and there was like all these, you know, headlines going like, it gives you cancer, it gives you heart disease.
Those were high doses.
Yeah.
These are like
women who are prone
doses.
already. Yeah.
These are like low doses.
Like tiny doses. Yeah.
Yeah. So I tell people that. And so I think that the more we talk about it, like the more we'll treat it. And I'm a physician, I treat it. And I even tell my colleagues, you know, some people just don't like treating it. So you hear as an OBGYN, when I heard you say that you don't do that or you don't, that's not your specialty. I'm thinking, no, I mean.
See, good, because not all doctors want to talk about it. They go, oh, that's not really what I specialize in, or
they just don't
like
want
even the doctor
to
was
prescribe
just
it. Yeah. They just don't want the liability. And so it's all about education. It's all about just laying all the risks.
The facts out. Yeah.
Benefits, and then making a plan to that patient, depending on their medical background or their medical problems.
Yeah.
You know, so it's education.
Yeah, it's not going to be the same for everyone, obviously, but like as far as hormones go, is there a problem with like sustaining it when I'm starting it so early? And like, what are the effects of like stopping?
It'll be like almost like, you know, bad PMDD. So PMDD is more serious than PMS. So premenstrual dysmorphic disorder. It's very.
I just heard about this. I think I have this. Yeah.
So as we get older, like it's when you start to, you know, be irate, or when people stop talking to you, your friends stop talking to you, when, you know, your relationship is over, you know, you know, seek help.
I know. When your eyes are like that. That's
you know?
me.
So like,
I thought I was just going in for period stuff when I found out the perimenopause stuff. Just my periods were wild. Like,
so it's a combination of both, you know? And so, the treatment's the same for both, for, you know, giving you hormones, and to treat, you know, PMDD, we start off with hormones. But I just like people to know that, hey, if you're scared of hormones, we can start with a non-hormonal option.
Is there something to like starting and stopping hormones that can be destructive?
Yeah.
Okay.
Yeah.
Just your mood is going to be fucking
You're going to be
wild.
all over the place.
Yeah.
So that's why I tell my patients that when we're doing a trial is 3 months.
Okay.
If you do
that's
a
another
month
thing.
and you're going off, you know, your periods are going to be worse, and you're going to be like, what hell?
Mine stopped.
Good for you.
I'm kind of sad about it. I had to do like a little rest in peace, and like, because like if I'm not suffering and things are not unfair, like am I even a woman?
Right.
Who am I without the pain and suffering?
Okay,
you know?
But that was a good point that you brought. I need to stress this because this is good, Jade.
Yeah.
So I said good for you. Like you said, no periods, right? I said good for you because you're actually on hormones. A lot of women think that if they don't have, they brag about it. Like, you know, like I went on vacation recently, and one of my friends I was like, are you going to be on your period on vacation? Do you want me to like stop your period? So, you know, we don't have to be on, you don't have to be on it when we're in Cancun. And so, she was like, oh, don't worry about it. I don't get my period. I get my period every 3 months. I was like, oh, are you on, what birth control are you on? She goes, I'm not on anything, but I don't have to worry about those things. I said, do you know that's bad?
That's bad. Yeah.
That's bad. So if you don't get your periods and you're not taking any hormones, go see your doctor.
Up. Yeah, that's your body communicating. Wow. Because I have a lot of friends who are like, I don't get my period anymore.
Like,
I'm like, you're iron deficient.
You know, like too bad for you. You know, like, so that's really important that, if you're not getting your periods and you're not on any medication, you're not being followed by gynecologists, and you just don't get periods, that is the cells. People think the cells you don't have a period. No, it's in there. The tissue is getting thicker and thicker and
Someone's
thicker.
like going like this to them.
And then you feel the heaviness. You feel it. And so, but people don't know. Women
That's one
don't
thing
know.
I'll miss though. I love to shed. Love to shed. Feels good. I love to scoop. That's one thing I want to ask you if it's like a false thing.
What?
We'll call these vag busters. instead of Mythbusters, not like, it sounded dirty. When we go into the shower, I scoop, like I'll clean it out. But I know a lot of women say that it's like a self-cleaning oven. And I know that's also true, but
but when you're scooping, so walk me through that.
So I'll go into the shower and I'll like put my finger in and I kind of like move around and I'll scoop whatever like is in there. Like if I had just had a period, it would be like old blood, or if like
that's okay.
Okay, cool.
That's okay.
It's everything scoop clean. Or not to scoop.
I think it's okay to scoop if your fingers, you're doing it in the shower, your hands are clean.
Yeah.
I don't see a problem with that. The problem is when you're putting stuff up there, herbs.
Or
you're putting, berries and
douches,
raspberry juice. I hear it all, and so that's when it becomes a problem. Then I know like back in the day, put vinegar and after your period and da 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 da. So all these wives' tales, that we're propagating.
And now with periods, also there's so many alternatives to like using a pad or using a tampon. Like, what do you use personally?
I'm a pad girl.
I'm shocked.
But
with wings? Do you wings?
Yes. Oh my God.
You need the wings.
Oh my God. When I discovered wings, I was like, I would do a commercial for these people. Like literally with the thin pads. I used to wear the thick ones back in the day.
The ones that are like diapers.
And my college friend changed my life. She's like, oh, you don't know there's thin pads? I said, hey, I have a heavy period. She goes, no, it holds more than those thick pads. She changed my life.
And what do you think about all these underwears that are coming out? Like there's all these brands that are like period underwear.
I love it. But just to, because you asked about personal. Yeah. So I use probably tampons now, tampons and pads, but listen to your body and listen to the people that love you.
And go to the doctor. Gynecologists are so fun. Look, you can go to Dr. Kendra, have a laugh, get your vag checked out, be healthy, drink lots of water.
Always
drink lots of water.
Always. I mean, you can be an honorary gynecologist.
I would love that.
There's
nothing that I like to do more than look at vaginas.
Because you're well informed, and bravo to you for like getting help and actually being informed.
I feel like I'm further away than even when I started, because now I have like almost too much information and there's such a lack of knowledge and it's so different. I'm glad that we're educating ourselves. So thank you for being here.
You're actually asking like the like medical questions, and cool. This is kind of like what people need to hear. Mm-hmm. And I think using it in a different platform like this versus, when I'm in the office, I can only tell one patient at a time, but something like this where I can tell, we can reach more women and kind of encourage them, once you find that doctor or that healthcare provider that you just connect with, keep them. And, follow them. My sister, she followed her gynecologist, who I love, everywhere she went.
Yeah, mine got like too busy. She's like a celebrity one. Now I had to leave her. I was like, I couldn't get an appointment with her. And her reel was playing in the lobby. I was like, what is this?
Right.
Your real dog. What is this?
Oh, right.
Like, it's important to have all that stuff now. Yeah. Obviously you need it. But I think that we lose that person-to-person kind of experience when it's that way. So we're like, this is an experiment. Check in with me. Because progesterone, I was like feeling really good after 3 months, but I was my period never
because
ended.
It's not, it's not that strong.
My liner. It then I read about something like how it makes you just keep bleeding forever.
Oh, because you need a stronger progesterone. So there's different levels of strength. So my favorite progesterone is Slind. And Yeah, so it's a stronger progesterone.
But that's a synthetic progesterone, right?
Yes.
So that doesn't help as much with mood and energy, I read. So that maybe not, but maybe that's bullshit. But it can.
But it can. Like all this stuff,
See?
I mean, okay.
Because my thing is mood and energy.
No, but let me tell you
was
though.
like this.
But let me tell you.
Yeah.
So the evidence, the science said perimenopause didn't start till 45. We all knew that it started at 40.
Yeah.
And really it's 38.
That's what people say, 38.
It's really like 38. You'll get a hot flash here and there. Yeah. But so the science is all like, that's why it's like, listen to your body. Like just because the science said 45, like they just changed it to 40.
No, because people were saying, when she told me, she was like, you're into perimenopause. I was like, what the fuck is that? Like, I didn't even know what it was. I was like, what did you call me? And then it all made sense. It's now making so much sense, like even a year back.
Really?
Yeah, I started getting just really, the mood swings were so
bad. That's like
bad,
noticeable.
Like I would just be like, and I started getting like my heart would just start speeding up in the middle of nowhere.
That's tachycardia. Yes, my friend had that. She had
like in the middle of the night, I would wake up.
Yeah.
And then I would be up for hours. Like I could not sleep. And then I started
Insomnia.
Insomnia.
See, tachycardia,
everything.
Insomnia, ashy ass skin, snake skin. I hate everybody and I'm homicidal once a month.
I heard about this thing. I also had this thing it's not rare, but it's like not as many women, dead shoulder. Like where my shoulder was like, I couldn't reach, I'm very athletic and I couldn't like, my arm like couldn't reach up. And I thought it was from like exercise. Like I was like, oh, maybe I pulled something. Went to a million doctors, like your shoulder's fine. There's nothing going on with your shoulder.
How long did the episode last?
Like 2 months.
Oh, 2 months.
Yeah, like it would not go, like I thought it was a physical therapy problem. Like I had knocked something out.
And you probably saw a neurologist and
I saw everything.
Like, to see the nerve was working.
Yeah, I was like, is it a nerve thing? Is it a physical thing? And then it just went away.
So it wasn't like an episode where you probably for a couple of minutes, you
no,
couldn't
it
lift
was like months. It wouldn't go away. I thought it was an injury.
Oh my, of course.
And then I read about this thing that was saying dead shoulder. It's like you just get this like weird ghost shoulder.
But I've heard about that, like, but in like maybe a couple of minutes.
Yeah, no, mine just lasted forever.
Who are you?
And then my hands were another thing.
What were you feeling? Tingling?
Yeah, like tingly hands, and then also like they kind of just hurt. And then I would just drop shit.
It's like inflammation.
Yeah, I just didn't feel like myself. I was like, I felt like I had something really intense and really severe. Like, is this a neurological
And you were like
disease?
dropping things clumsier?
Clumsy. I just kept running into shit. Like I would always grab my keys to go out and always drop them.
Right.
So anyways, this has been very educational and very lovely.
Yeah, so that's perimenopause.
And it's good to not feel alone. I think that's something that we all feel very alone in our journeys, and like we need to gather together. Be in line at Starbucks talking about it.
Because we don't want to be like, oh my God, you're 40 and you're already like experiencing perimenopause.
Let's change that.
Like that's why people don't want to say, women don't want to say that, oh my God, like so many women pee on themselves a little bit when they laugh, cough, or sneeze, but no one wants to admit that because it's just like, oh my God, you're like, I mean, right now is like you have urine in your under, like what's going on? We're still shaming each other. Women, we are horrible to each other.
It's true. Nobody even poops in a women's restroom. I like to stay in the stall and wait for them if they're trying. You know what I mean? Yeah, because it's like, just, like we don't even do that. We don't even allow ourselves to be in the restroom, which is for pooping.
Right.
Peeing too.
Meanwhile, guys are like, hey, did you smell that fart?
Yeah.
It was good. It was bad, right?
But let's like normalize talking about it being human. Let's normalize being human.
Can we?
We can do it.
Fuck this shit. Like, okay, you know what?
There's bras with nipples on it. We can do this.
We're sweating and we stink. That's another menopause, perimenopause.
Oh, I smell bad. I smell bad.
You're like,
I've never smelled ever.
Deodorant.
Yeah.
I swear I just took a shower and you stink. The BO changes.
I wrote that down to ask you. So that's a thing that I've never smelled bad. And all of a sudden, like the last month, I'm like, I smell weird. You okay? Was that a weird thing for me to say? Is that funny? I'm smelly. That's okay. That's normal. So cute. Did you see it? Yeah. Did he fall bad?
Oh, God.
It's a heart attack.
Oh, God, that was so funny. Okay. I love you,
But
babe.
thank you for being here.
God,
and thank you for doing what you do.
I love what I do.
Is there somewhere where people can find you, like where you want to direct people?
Yeah, oh my God. So Instagram at Dr. Kendra MD. And I'm new to TikTok. So you guys follow me there. Ask Dr. Kendra on TikTok. And my website is also Kendra, or ask Dr. Kendra, something.
We're going to have a little link on the bottom. We'll find it.
But yeah, but definitely TikTok. I'm new, guys. I'm learning the ropes. So definitely, say hi and tell me where you met me or saw me. But I love what I do. And I love you.
Come on.
In love.
Same.
And I hope that, we can at least help one woman out there.
Yes.
That, that we touched on topics that they can relate to.
Yeah. Well, thank you for stirring it up. Yeah.